enfants à travers.
Parfait, merci. Donc, bonjour à tous. C'est vraiment un grand plaisir pour moi d'être ici aujourd'hui. On peut passer à la prochaine diapositive tout de suite. Donc, je me nomme Alexandra Gagnon, puis je travaille à Santé Canada avec le programme de santé environnementale. On peut changer à la troisième diapositive. La prochaine, ouais. Donc, les substances chimiques peuvent avoir des effets positifs ou bénéfiques sur notre santé. Donc, on sait les substances nutritives, les médicaments, les désinfectants, les insectifuges, même les produits ménagers dans les maisons, les meubles, les couvertures. Mais toutes ces choses-là peuvent aussi présenter des risques pour la santé s'ils ne sont pas manipulés ou utilisés correctement. Donc, on peut passer à la prochaine diapositive. C'est pour ça que je suis ici aujourd'hui. Donc, moi, je travaille avec le programme de santé environnementale à Santé Canada. Puis, le but du programme, c'est vraiment améliorer la santé des gens associés aux substances chimiques en évaluant, en gérant puis en communiquant les risques potentiels sur la santé. Puis, moi, je travaille spécifiquement pour le programme de plan de gestion des produits chimiques. Donc, on va voir sur la prochaine diapositive, c'est quoi le programme de gestion des produits chimiques. Donc, c'est un plan qui a été développé en 2006. Puis, le programme de santé environnementale a fait l'évaluation de 4300 substances chimiques existantes qui ont été jugées prioritaires. Puis, cette stratégie-là a été mise en œuvre justement pour gérer les risques associés à l'exposition des produits chimiques, puis pour communiquer les informations pour réduire les risques associés aux produits chimiques. Donc, nous, on juge que la responsabilité d'exposition aux produits chimiques est divisée en 3 parties. Donc, on a le gouvernement du Canada, donc tu as mon rôle à moi qui est de transmettre l'information aux gens. Tu as aussi les industries, puis tu as l'individu. Donc, nous, ce qu'on fait, les agents des risques, c'est qu'on fait des présentations aux gens, puis on leur transmet de l'information par l'intermédiaire de présentations, des brochures, des activités, quand ça vient aux substances chimiques. Donc, c'est quoi des substances chimiques, quel genre de substances chimiques qu'on peut retrouver dans les maisons, puis c'est quoi des choses qu'on peut faire à la maison afin de réduire les expositions aux produits chimiques. Donc, on peut passer à la prochaine diapositive. Donc, comprendre pourquoi certaines personnes sont plus susceptibles aux expositions chimiques que les autres est un aspect assez important dans la gestion des produits chimiques, donc particulièrement pour l'évaluation du risque. Donc, Santé Canada tient en compte les populations vulnérables dans ses évaluations des risques des produits chimiques nouveaux et existants. Donc, les enfants sont plus sensibles que les adultes aux contaminants présents dans l'environnement pour plusieurs raisons. Donc, premièrement, les enfants ingèrent généralement une plus grande quantité d'air, d'eau, puis d'aliments par rapport à leur poids corporel. Aussi, le corps et les systèmes de l'organisme des enfants sont encore en développement, ce qui diminue leur capacité à gérer ou éliminer certains produits chimiques. Donc, ça peut les rendre plus sensibles aux effets nocifs des substances chimiques. Puis aussi, évidemment, les enfants passent davantage de temps en contact direct avec les surfaces quand ils rentrent, puis mettent aussi beaucoup de choses dans leur bouche. Donc, on a des jouets, la terre, donc un peu n'importe quoi qu'ils trouvent par terre, les enfants vont peut-être le mettre dans leur bouche. Puis, ces deux comportements-là peuvent entraîner une ingestion accidentelle de produits chimiques, puis nocifs. Donc, nous, à Santé Canada, c'est ça, on fait des projets pour justement essayer de diminuer les risques associés aux substances chimiques, puis aussi quand ça vient aux populations vulnérables comme les enfants. Donc, je vais vous montrer quelques initiatives qu'on a faites avec Santé Canada. Je suis toute nouvelle employée, donc j'ai seulement commencé à travailler au mois de novembre de façon permanente avec Santé Canada. Donc, ce n'est pas des projets que moi j'ai travaillé dessus, donc c'est mes collègues, mes anciens collègues qui ont travaillé sur ces projets-là. Mais je veux vraiment mettre de l'emphase aussi sur le fait qu'on a une vision assez innovatrice au sein de notre équipe. Donc, si jamais que vous avez des suggestions, si jamais que ça vous intéresse de travailler en équipe avec nous, on est toujours ouvert à faire des collaborations avec les gens quand ça vient à des projets qui touchent justement les populations vulnérables associées aux substances chimiques. Donc, sans plus tarder, je vais vous présenter quelques initiatives qui ont été faites par Santé Canada, puis on peut aller à la prochaine diapositive. Ah oui, donc on travaille avec, justement, ces initiatives-là ont été faites avec plusieurs partenaires. On a travaillé avec des éducateurs et éducatrices de la petite enfance, des centres de ressources familiales, des infirmières, infirmiers, des écoles primaires, secondaires, beaucoup d'organismes à but non lucratif. Puis ça, c'est pour délivrer justement, délivrer et développer divers outils d'éducation. Donc, le premier que je vais vous présenter, la prochaine diapositive, c'est Eddie, le chat super-héros. Donc, ça a été développé avec une équipe de la Nouvelle-Écosse, donc avec la province. Puis, c'est vraiment une application qui peut être sur les téléphones cellulaires ou sur les ordinateurs. Puis ça peut être utilisé avec des parents. Donc, c'est pour les enfants, mais ça peut être avec les parents ou même les enseignants dans les écoles, ça peut être utilisé dans les écoles. C'est vraiment pour en savoir plus sur l'importance de l'art pur puis des énergies renouvelables et des actions afin de garder les communautés propres. Donc, c'est vraiment des petits quiz, il y a des messages, il y a des activités, des mots cachés, des choses comme ça qui permettent aux enfants d'en apprendre davantage sur la qualité de l'art. Puis après ça, on a aussi la prochaine diapositive, développer plusieurs présentations qu'on offre justement à la liste de personnes, là, infirmiers, infirmières, des nouveaux parents, des éducateurs, éducatrices de la petite enfance, qui donnent des conseils justement pour réduire les expositions aux substances chimiques. Donc, premièrement, comme exemple, il y a conserver les produits chimiques sous clé. Donc, comme vous pouvez voir, on a des substances chimiques qui ressemblent à des substances qui ne sont pas nécessairement nocives. Donc, on a des Tylenol versus des Smarties. Donc, on voit qu'il y a quand même une assez grande ressemblance entre les deux substances chimiques. Puis, un enfant ne pourrait pas vraiment faire la différence. Donc, c'est important de garder justement les produits chimiques sous clé. Ça semble vraiment comme des conseils assez banals, assez simples, mais on utilise cette approche-là justement parce qu'on veut des conseils simples qui amènent des changements de comportement assez clairs puis assez importants quand même. Un dernier petit exemple que je vais vous donner aujourd'hui, donc c'est vraiment pas notre liste complète, mais je ne voulais pas faire une super grande présentation non plus. La prochaine diapositive va vous montrer qu'on a aussi travaillé sur un livre d'activité qui parle justement des substances chimiques. Donc, ça touche les enfants de 7 à 9 ans. Puis, c'est une bande dessinée qui compte à peu près 30 pages, qui est bilingue. Puis ça va être imprimé puis envoyé de façon nationale, donc à des endroits clés, donc soit dans des écoles, dans des bibliothèques. On planifie aussi de faire la lecture de ces bandes dessinées-là, peut-être devant des groupes d'enfants, justement. Puis il y a des activités qu'on peut faire aussi, donc identifier des substances chimiques, des mots croisés, encore une fois, donc toutes des choses associées aux substances chimiques, puis apprendre comment justement éviter l'exposition aux substances chimiques dans les maisons. Donc ça, c'est un peu, on peut passer à la prochaine diapositive. C'est en gros un peu ce que nous, on fait au sein du programme CMP du programme de santé environnementale à Santé Canada. Donc, c'est comme je dis, c'est quand même un assez gros résumé, un petit résumé de qu'est-ce qu'on fait, mais je suis toujours intéressée, c'est ça, si jamais que c'est quand même assez de la nouvelle information pour moi. Donc, si jamais vous avez de l'information, vous pouvez ajouter mon adresse courriel, puis m'envoyer de l'information aussi si ça vous intéresse de faire des collaborations quand ça vient à travailler avec la santé environnementale associée aux enfants puis aux substances chimiques. J'aimerais aussi, on a un programme qui parle beaucoup des changements climatiques. Ce n'est pas notre programme qui s'en occupe beaucoup, mais cette année, on essaie beaucoup de travailler pour inclure justement des messages associés au changement climatique puis des impacts que ça peut avoir sur la santé humaine. Donc, c'est des projets qu'on a en vue pour les prochaines années fiscales. Donc, merci beaucoup. Puis, sans plus tarder, je vais vous passer la parole à Melanie Langille, qui va vous présenter un peu les toxines associées qui ont des effets sur les enfants. Merci. We can't hear you, Melanie.
Thank you. I had my mute button on. So thank you so much, Alexandra, for that Health Canada perspective on chemicals management and particularly how they affect children. My name is Melanie Langille. I'm the president and CEO of the New Brunswick Lung Association. The New Brunswick Lung Association has for many years worked in the areas of environmental health, not strictly related to lung health. And we started it with an air quality perspective. And now we do work quite a bit more broadly than that. So I've got two logos here that are two projects that we run, one being the Foundation for Resilient Health, which is broadly concerned with toxins, also climate change and effects on health. And then we also host the Canadian Network for Human Health and the Environment, which is a network of 600 or 700 individuals coast to coast that are interested in environmental health and engaging with the with policy at the federal level through the chemicals management plan that Alexandra mentioned. And next slide, please. And not to reiterate what Alexandra said too much, but when we talk about children and chemicals exposure, like Alexandra said, we do have increased risks, and children are more vulnerable to toxics from their physical developmental stage. They may also lack the enzymes that an adult would have to detoxify some of these toxins in their body. And on a weight per weight basis, they are exposed to more, and they put things in their mouth. I have young children myself, and sometimes the things that they find under the couch, or the dust bunnies that may have accumulated behind the furniture, they end up in their mouth. They're crawling all over everything and getting into all sorts of things. And what's really important to consider is that all of these toxins that children may be exposed to can result in developmental delays. And that's not just an issue on an individual basis, but this can have long-term social consequences for the whole population. This can restrict a child's ability to reach their peak, their full academic potential, which again has societal consequences. So that's why we're really involved in this topic. Next slide, please. So in the home, there's a number of sources of toxins. And these slides that I'm going to present here are excerpts from a toolbox that we've created that we call Healthy Habits for Healthy Homes. If you're interested in putting on a presentation like this for a community group or a group of educators or parents, please feel free to reach out to us. We have presentations and guides and all sorts of things freely available to you, and I'm happy to walk you through this. Next slide, please, Sadhya. Of course, being the Lung Association, we do put an emphasis on air quality. We look at indoor air and outdoor air. This is the screenshot here is an interesting excerpt from another project that we're doing, where we have, working in partnership with Environment Canada, deployed a number of small PM2.5 sensors across the province. So PM2.5 is fine particulate matter, smaller than 2.5 microns in diameter. Mainly the sources of those are vehicle emissions, industrial emissions, and wood smoke. And particularly with climate change, we're seeing longer and more intense wildfire seasons. So this is an area that's of particular concern. And wood burning, of course, is another source of fine particulate matter. And when we had the wildfire events of last summer, these sensors, if you're interested in this, I can put the link in the chat when I'm done speaking. But these are real-time sensors with our average PM2.5 readings. So we were able to kind of watch that smoke be transported from the west and into our province, and then be able to communicate out to the public about the potential health risks there. Next slide, please. Inside your house, there's also lots of areas for potential air pollution. So cigarette smoke is a pretty obvious one, but there are also things like fragrances, chemical cleaners, molds. These are all areas that are sources of indoor air pollution. And it's important to recognize these, and our program, same with what Alexandra was saying, provides a number of really simple steps that you can take to minimize your exposure to these chemicals in the home. Next slide, please. Plastics is an area that is hard to avoid these days. It seems to be pretty much everywhere. But a lot of plastics have a lot of hazardous ingredients in them, between plasticizers like phthalates, bisphenols, and styrenes. You don't need to understand all the chemical names behind these, but those are some of the larger classes. And they leach toxins into food when they're heated. So if you are putting hot food or leftovers into a plastic container, heating it up in the microwave, there is potential there for toxins to get into your food. So we try to avoid those as much as possible. Some plastics are are more hazardous than others. So you see down the bottom, we have safer choices and then some of the recycling symbols to avoid. The recycling symbols give you an indication of what type of plastic and not necessarily whether it's recyclable in your regional facility. So not all recyclables can be, or not all plastics can be recycled, sorry. Next slide, please. So a few tips to avoid, toxics in toys for children. Wherever you can, reducing your consumption of plastics is a good idea. So as you are purchasing toys for children, wherever you can, choose wood or metal or cloth, other natural components. Even limiting the number of toys. I know my kids have bins and bins of toys that don't get touched for months and months. And they would probably be just as happy with a cardboard box, to be honest. Costume jewelry is another area that can be an area of exposure to components such as lead, cadmium, and some other heavy metals. So we want to make sure that if our children are playing with costume jewelry, that they're not putting them in their mouth at all. Polymer clays is another one. There's potentially some toxics hiding in there too. Next slide, please. Sadia, can you go to the next, please? Thanks. So again, we offer some simple solutions. Thank you. Oh, that's fine. Simple solutions to avoiding toxics in the home. Glass storage containers are really great. Even just as simple as letting your hot food cool before putting it into a plastic container for storage if plastic's all you've got. And then dumping that food onto a plate before you heat it up in the microwave rather than just putting that plastic container in the microwave. That can prevent exposures to all kinds of plasticizers. Next slide, please. Nonstick cookware is another area that there's potential exposures to a variety of chemicals. Per and polyfluorinated alkyl substances, or PFAS as it's referred to, is man-made nonstick coatings, grease-proof, waterproof. It's kind of in a lot of things. So we do recommend that folks replace, as they are able to, replace their nonstick pans with stainless steel or cast iron pans. And certainly, I don't recommend buying a nonstick frying pan secondhand from a thrift store. I love thrift stores, but this is not the type of thing we want to see people using, especially this one that is quite chipped, that leaves more opportunity for those chemicals to leach out of the pan and into the food. Next, please. So personal care products is another area where there's a lot of potential for chemicals. This is a really challenging one because it's easy to overlook the fact that your skin is actually an organ. And so anything that you put on your skin does get incorporated into the body. And a lot of the chemicals that are used in personal care products, particularly fragrances, don't break down in the body. So anything that you're putting on your skin day over day over day over day is actually building up and increasing that toxic load within your body over time. There are a number of ingredients that are used in personal care products that are known carcinogens, pesticides, or chemicals that disrupt the endocrine system, the hormone system in the body. So generally our recommendation is to limit your use of personal care products, and for those that you do, look for ones that have short ingredients lists wherever possible. And I'm kind of chuckling to myself because that is easier said than done. Reading labels, particularly on consumer personal care products, is challenging. It's just something to be mindful about. Next slide, please. Oh, I think we had a wrap-up slide there, so yeah. If not, that's fine. In any case, that wraps up what I had prepared to speak about chemicals. from a children's health perspective. Happy to take any questions that anybody might have. And also, I'll put some links in the chat if people are interested in exploring the programs that we have a little bit further. And so how did you want to do questions, Sadia or Tim? Did you want to have people unmute or put in the chat?
You can ask the question. So.
Feel free to write them in the chat, or you could use the raise your hand
Raise
feature
your
for
hand.
sure.
I have the.
So sure you saw it in the chat, but Selja is just asking if there's something you'd like to add about sunscreen. Is there a natural alternative?
Yeah, for sure. So thanks for that question. It's super important. Comes up a lot, especially as we're getting into the springtime. From what I understand from a chemicals management perspective, there are lots of chemical sunscreens. There's also what's known as physical sunscreens. So the mineral sunscreens that are made with titanium dioxide they actually have small particles in them that will physically reflect the sunlight, as opposed to a chemical barrier like the other sunscreens. One thing that you should be mindful of when you're purchasing a chemical or a mineral sunscreen is there is still currently some assessments going on nano zinc. So that's not, it's very, very, very small particles of zinc. And so those are still under assessments, but I would stick to the titanium dioxide. It does tend to make your skin a little whiter. So because it is physically a barrier to the sun's rays, but there are a lot of different brands that are making these mineral sunscreens now. Used to be very a specialty thing that you'd have to go to sort of a boutique shop to find, but I've found regular familiar brands at Walmart in the last couple of years, so that they're certainly out there. Mineral is the way to go. Then yeah, you're talking about environmental working groups. That is great. There's an app called the Think Dirty app where you can scan barcodes of products in your home, your shampoos, your soaps, all those sorts of things, and it gives you a color code based on whether there's sort of some red flag ingredients in that product. Thanks, Adia, you're adding the toolkit there. Yep, thank you, thank you. Yeah, environmental working group Skin Deep is a great resource, and thank you. Tim, you had a question?
Sure, if there's no other questions, I'll insert one here. I'm just peut-être pour Alexandra or yourself, either of you, about radon, which I know is kind of a top cause of lung cancer yet, and also very prevalent in a lot of homes, even though people might not know what it is. Are there programs to, I know it's also something that's like expensive to test for, and then also to rectify if you do find some. So are there programs to help people like both get testing done and then to help them solve the problem if they do find unhealthy levels of radon in their home?
Yeah, I can speak to that. From a lung association perspective, is certainly something that we are concerned with. It's the second leading cause of lung cancer after smoking. We have lots of resources about that here. We run a program of, we provide, we sell the radon testing kits, the do-it-yourself kits. Very simple to do. We have some resources on our website about how you do that. It's not very expensive to test for. Our kits are $35. If we have to mail them, there's obviously a shipping fee. But in terms of the mitigation, if you do have levels that are high, that is where we are running into some challenges. It can be expensive, probably in the order of $3,000 to $5,000, depending on the configuration of your house and the levels that you've got. So I'd love to see a program to help people with that cost in the future, but my conversations so far have not been overly fruitful in that regard. 20% of homes in New Brunswick will have higher than what Health Canada deems as a tolerable risk level of radon in their homes. And so certainly an issue that we're concerned with. And New Brunswick has some of the highest levels in the country. So I don't know, Alexandra, if you want to chime in from a Health Canada perspective.
Yeah, for sure. So I am working closely with the radon specialist in Atlantic, Rashini Casey, and she's working really hard towards like mitigating risk associated with radon. I know during a radon month, they were giving kits for radon testing, but throughout the year, they're not giving them like throughout the whole year, but they are accessible also at hardware stores for like $50. And then you put them in your house for a couple of months during preferably winter time. And then you send them to a lab to get tested. You get tested for radon. But same thing when it comes to paying for the solution, it is expensive, and right now we do not like give any resource to kind of fix that, which is unfortunate, but I think it's something that definitely like we could think about, or trying to figure out something, you know, like just on the mitigation side. But when it comes to fixing it, we don't really have a solution yet.
Renee, you put your hand up.
Yes, thank you for your wonderful presentation. So with sunscreen comes bug spray. So do you have something to tell us about bug spray?
Just Melanie and Alexandra will give you like a minute or two to answer that, and then we'll have to move on. But one question.
Yeah, I don't have anything right on the top, right on the tip of my tongue, Renee. I would have to do a little digging on the sunscreens or the bug repellent sort of thing. What we generally recommend to folks is the physical barrier. So if you're walking in an area with ticks, for example, long sleeves, long pants, tuck your pants into your socks, tape them up if you're really getting ambitious. But if they can't get on your skin, then that's going to be the most effective way. And then always checking for ticks if you've been in an area of high risk, you know, long grass, brushy sort of stuff. Not so much if you're walking on a wide trail in the woods, but if you've been wandering around through long grasses, to do a check everywhere, little crevices that ticks like to hide, like the backs of your knees and dark places like that. But from a bug spray perspective, I would have to look into that a little bit more. I know DEET would certainly come with some health risks, and I would avoid it.
Yeah, usually we advise just to follow the instructions, like not if it on the label it says not to put it on skin, then, you know, like don't do it, just put it on your clothes or whatever it says on the instruction, just to follow it.
Thank you.
Thanks for all the questions. I could talk toxics all day, but I'll be done. We'll be done for now.
Thank you.